Well, this year's virus season has already taken a toll on so many families. It's also taken a toll on those supplies of over-the-counter flu medications. I went into CVS, I couldn't find anything.
Oh, the shelves are kind of bare. Chances are, if you've been to a pharmacy lately, you may not have found some common fever reducers available. This was my story at my house this week. So, Dr. Frank McGeorge is here with the patient's guide to managing a fever without the medication.
Well, Karen and Christy, first off, I want to point out that fever is not always a bad thing. By raising the body temperature, a fever actually enhances the function of our immune system, and it's in fact helpful. Of course, it's also uncomfortable, and there is a point where a fever in children should be treated. So here's some ways to do it without using medication.
Really, one of the most important things we could do really for any sort of illness or when our kids are not feeling well is make sure they're staying hydrated.
When you have a fever, your body naturally loses fluid faster, according to Dr. Kevin Daisy, a pediatrician at Children's Hospital of Michigan.
Those cool fluids will help their body just cool down naturally on its own.
Allowing the body to cool off naturally is a simple thing to do. That means rest and light, loose-fitting clothes. Now, another go-to that can help without the use of fever medication is a simple old-fashioned sponge bath.
We don't want to do an overly cold bath or an ice bath. That's one thing not to do. When we're talking about trying to cool our kids down. But a lukewarm or a tepid bath, you could use a washcloth or a sponge. But again, make sure it's kind of in that lukewarm variety, just enough to make them feel more comfortable and lower that body temperature just a little bit.
And finally, Dr. Daisy cautions against two things parents might wonder about.
Never give aspirin unless directed by your doctor or pediatrician, and do not give it for a fever.
Also, grandma's old-fashioned rubbing alcohol isn't recommended for cooling.
That's bad for a couple different reasons. Number one, there is no such thing as the evaporation effect of alcohol, and number two, just the absorption or even just the air itself of that alcohol can make kids just not feel well.
Now, I started out by saying that not all fevers are bad, and that's true, but I should also point out that recurrent high fevers, like over 104, or any fever in a child under 3 months, or fevers that are associated with other symptoms like a productive cough or a change in alertness, those are all reasons to call your child's pediatrician.
Absolutely. And Frank, when my kids were even a little younger, we talked about the high fevers, though, perhaps causing seizures. Is that something that parents should still look out for?
Well, if your child has a history of a febrile seizure, there's actually a pretty good chance that your doctor has talked to you about managing a fever or even a seizure. But for the average child, you really shouldn't be afraid specifically about a seizure with a fever. It's reasonably uncommon. The bigger concern is actually with a high fever is really more what the underlying cause might be. So that's where you're seeing your doctor, not because of the febrile seizure concern.
Yeah, and we're seeing a lot of fevers this time of year.
Yes,
So
sure are.
thank you.